People are working longer hours, higher cost of living, longer commutes. We're always connected, to our phones every second. I mean, who would have thought that we'd be spending, every moment on these things? Because we've had this kind of cultural shift in society, we are now at higher risk for depression, higher risk for anxiety. Suicide rates, unfortunately, have skyrocketed. We've seen, these really tragic stories in the news. And a big problem of this is that change in our society is not going away. People are now more living to work versus working to live, and that's not going away anytime soon, for better or for worse. But what we haven't done yet is equipped ourselves with the tools to be resilient to those stressors.
And tell us about some of the numbers you're seeing that maybe were even surprising to you when you started looking into this.
1 in 3 employees, regardless of age, race, industry, deals with a mental health issue. That's costing employers $210 billion per year annually in the US. Now, that number is actually grossly understated because it only represents folks who are dealing with mental health issues at a more clinical scale. It does not represent, folks who deal with the stress and struggles of everyday life and, maybe they're going through a breakup or divorce or just had a child and going back to work. Kind of these everyday stressors which obviously impact people in the workforce.
I mean, you can go online, find a therapist through there. You can go through some of the employee assistance programs to get help. How, as a startup, are you approaching it differently?
Right now, 60 to 70% of mental health professionals do not accept health insurance. So what happens then is if you'd like to go find a mental health professional through your insurance, it's an absolute headache. It's a nightmare. Maybe call your insurance company, they'll give you a list of providers, you'll call all 30 of them, none of them are accepting new patients, and maybe one is and they have an opening, 3 months down the line at 12 p.m. on a Tuesday, and you can't leave work to go see that person. So you end up not getting the care that you need. Now, maybe you try to use your EAP program, which, EAPs, employee assistance programs, were developed in the 30s as a solution for drug and alcohol abuse, and there's been very little innovation in the space since then. Very few people want to actually call a 1-800 number and talk to a customer service rep in order to get care. They want to do things digitally. Number 2 is there's not enough mental health professionals to support the number of individuals that need care.
Is your hope to get everybody to workplace on it so that in a sense you're interacting with those people, or I don't know to say monitoring, but that they're a part of the system, or is it just for people to select it?
20% of the workforce deals with depression and anxiety at a severe clinical scale. Our approach is let's be proactive and preventive. Let's build a more resilient workforce so that people don't end up in that 20%. So in order to do that, there's 2 things that need to happen. One is we need to remove the stigma and taboo associated with mental health. When we say the words mental health, people think of, oh, that's a weakness, like something is wrong with that person. We need to change that as a society. Number 2 is offering a modality for everyone. So some people want to go see someone in person. Some people want to talk to someone on the phone. Some people don't want to talk to anyone. They just want to go through a digital curriculum through a mobile app on their own. We're the first solution to offer a full suite of services regardless of where you are in that spectrum.
And one of the big things is the term coaching.
We found that by calling a therapist or even coaches that we're now able to get more people to engage. And why is that? Because it's normal to have a coach. You have a coach when you're on athletic teams. You can have a career coach, an executive coach, a leadership coach. It's normal to get coached through those things because when you're coached, that's viewed as you're improving, you are strengthening yourself.
You have an all-female team.
Yes.
How is that going to impact the direction of your startup?
So right now we're an all-female team. My co-founder and I, of course, female founders, which was a really unique and cool experience for us to go through in Y Combinator. There's a finite number of all founders being female. For us, we're really excited because it gives us a unique insight into what we're doing. Obviously, we're supportive of diverse perspectives, so we've got a handful of advisors, investors, friends, family with diverse background that kind of keep us on our toes and kind of play devil's advocate in our approach and our thinking. I think what's really exciting and resonates for us is we've actually seen that women are at higher risk for depression and anxiety, and that's a result of a host of different reasons, but predominantly that women of our generation are working later in their life, they're delaying having kids, and that really is, we're seeing to have an impact.